We should be practicing person-centred care all the time, reliably and to as high a standard as we possibly can. For me, it's about delivering care, support or treatment with compassion, with dignity, with respect, always. And also delivering it in a way that enables people, so it focuses on their strengths and focuses on supporting them to build on their strengths. So it's enabling. It's also personalised, so it really focuses on what's important to them, what matters to them, what their preferences are, what their goals are. And it's also coordinated. In other words, all the people who are involved in the care and support of people who live with any medical condition are working together, and demonstrably so. You know, I think it's really incredibly important to have the voice of patients, of service users, of people with lived experience in the room, always. To help us all together co-produce our services, our systems, our organisations. There are times when it's less easy or impossible for the voice of the service user to be there. So whenever I'm in that position, I always talk about Dorothy. One of the things that we've been doing is trying to figure out what a logic model looks like for Dorothy. And a logic model is frankly just a series of steps that make complete sense for Dorothy, with Dorothy's worldview about the way the health service should be. So, you know, a logic model, if Dorothy develops, let's say, knee pain, is that she might try a few things for herself, and then she might ask a neighbour what she's tried, and then she might, if those things aren't working, go and see the GP. And the logic model at that point is the GP should treat her with dignity, compassion, respect, should personalise the conversation, should have an enabling way about them, and should therefore work with Dorothy to focus on delivering care, support or treatment that's right for her. I would see it so that if we always reliably employ person-centred healthcare, then de facto the system will become a prudent system. So by enabling people, enabling communities, by supporting people to focus on what's right for them, by supporting them to understand their choices, by supporting them to understand this concept of overdiagnosis and overtreatment. So there's a whole series of ways in which we can work with people in a person-centred way, which will deliver person-centred healthcare. So in order to deliver on prudent healthcare, always put patients first, will be my way of thinking.